Good evening, Gordon Causey, coming live right now. It's 12:30 a.m. So either late at night or early in the morning, however you want to look at it. Late Wednesday night, early Thursday morning. It's actually, with it being 12:30, it is now the 22nd of September of the year 2022. And I just wanted to give a quick update on the numbers being reported by the Centers for Disease Control and Prevention out of the United States. And they just reported for the week ending September 17th. They just updated the numbers yesterday. I check them daily, and they finally updated the numbers. And the positivity rate for monkeypox testing has climbed to 23%. It had been declining for the week ending August 20 of this year. So just August 20th, the positivity rate was 24%. Then it went down to 20 in the following week to 23 to 22. And then for the week ending September 10th, it went down to 21%. So there'd been a steady progression downward. Now it's climbed back up, and it's back up to 23%. But the big, most surprising aspect of it for me is the absolute plummeting of testing levels. Back on August 20th, the amount of testing, the number of tests conducted, and I'll note that if you go to the website down below, this is individuals being tested. So a person might get more than one test. If they have lesions on their face and on their hands and maybe some other more sensitive areas, they could have 2, 3, and maybe I assume more tests done on that one individual. And what the numbers they say in their article or on their website indicate that this is tests per individual. So when it says that on the week ending August 20th, so the 7 days leading up to August 20th, they performed 18,134 tests. 18,134. That's actually 18,134 individuals who were tested. Those individuals may have had more than one test. So they tested 18,134 people for the week ending August 20th. A week later, the week ending August 27th, it dropped from 18,000 to 14,875. For the week ending September 3rd, it dropped from that 14,875 down to 11,490. Then for the week ending September 10th, it dropped all the way to 7,625. And for this most recent period, the week leading up to September 17th, the testing level had dropped all the way down to 4,573. To put that into some perspective, in just about a month's time, testing has gone down by 75%. For the week ending August 20th, they tested 18,134 people. For the week ending September 17th, they only tested 4,573 people. And that's in a country of 335 million. And I get that some will say, well, the reason the testing has dropped is because there is less demand for testing. I question that. I've linked down below an article from a publication called The New Republic that's been around for longer than I've been alive. And it's generally regarded as a very left-leaning, almost a socialist publication. And political bias aside, I consider it decent journalism. I like to listen to all sides, not just I don't want to be stuck in my echo chamber, as it were. And that article speaks about how restricted the testing is, and it brings up a point called ascertainment bias. And basically, ascertainment bias means you want to ascertain a certain goal, so you you have a preconceived bias as to the nature. In the case of monkeypox, your assumption is that, well, this is a disease among men who have sex with men, among gay men. So we're going to focus all our testing, or 98% of our testing, on gay men. And then what happens? Well, 98% of the cases we're identifying are in gay men. But that's 98% of the individuals you're testing. Yeah, because they're the ones who get it. Well, are you testing other groups? Well, a little bit, 2%. They represent 2% of the cases. It's a case where, and the article speaks to this, that medical providers, an individual go in presenting symptoms consistent with monkeypox, inclusive of the rash, and they will be asked questions, screening questions. Are you gay? Have you engaged in a random sexual encounter with another man recently? And if someone says no, the article indicates that someone is far less likely to be tested for monkeypox. Oh, well, then it can't be monkeypox, because this is this is a disease that transmits in the gay male community. And it's an excellent article. I'd invite anyone to read it. You have to subscribe. However, you're given X number. I don't know how many free articles you're allowed to read. But if you've never read the New Republic before, then you'll be good to go to read that article. I don't subscribe to any of this stuff. News and information should be widely available. The article quotes a Dr. Caitlin Rivers, who's from John Hopkins. If you haven't heard of John Hopkins, it's she's one of the top medical schools in the States. And now I've lost the part I wanted to read. And pardon my in the article it says, this doesn't necessarily mean monkeypox is suddenly moving into new populations. Another option is that we could simply be getting better at identifying the cases already in these groups. Dr. Caitlin Rivers, senior scholar at Johns Hopkins Center for Health Security. And the third reason might have to do more with human nature than virology. Some of these cases may actually be from sexual contact, but they're not being reported as such. That's something providers need to keep in mind, that not all patients are able or willing to disclose their potential risk factors. If a patient comes in and says, I want you to test me for monkeypox, I mean, absolutely, I'll test you for monkeypox, because number one, it's no skin off my back. But number two, there are things that patient knows that maybe they haven't told me. You don't know if they have some risk factor that they don't feel comfortable telling you. Another indication that we're still not testing widely enough has to do with the phrase popularized by the COVID pandemic, test positivity. More than 1 in 4 monkeypox tests are currently coming back from the lab positive. That's dropped since this article came out. That's too high. Even for a disease, this is Dr. Caitlin Rivers, that's too high, Rivers said, even for a disease that has some pretty distinctive symptoms that make it far easier than others to diagnose. With monkeypox test positivity, something like 10% feels right. It's possible that test positivity is high because clinicians are so good at knowing when symptoms are likely to be monkeypox and are only testing then. But at this stage in the outbreak, with only a few months of experience making such diagnoses in countries where monkeypox has never spread like this before, it's very likely that some cases are slipping under the radar, Rivers said. I think it's worth testing broadly and trying to get that test positivity down. I think it's a case right now. What we're seeing is that I think we're seeing again the politicization of medical science, and there's a desire for the Biden administration, for the Trudeau government here in Canada. They don't want to be seen as repeating the same mistakes they made, the COVID nonsense. And so one way to simply make it look like COVID is going down is just to significantly reduce the amount of testing. It's the Donald Trump method. If we stopped doing the testing, it would go away. Well, yeah, because then we wouldn't know about any cases. They'd still be there. It's the old analogy of if a tree falls in the forest, does anyone hear it? If someone has a monkeypox case and no test is done, is it really a case? In our hyper information age, if there are no cases being reported, then the cases don't exist. And so what we're seeing is testing going from 18,134 in the United States, 18,134 people tested week ending August 20th, and now it's all the way down to 4,573 for the week having just ended on September 17th. The testing has dropped by 75%, but the positivity rate is going up. I equate it to this: if you have a professor of a university psychology class with, say, 350 students in her lecture hall, and she's asked, how are your students retaining the material? And she says, well, we in a sampling of 100 of our 350 students, 98% of them are retaining 95% or better of the material. Wow, sounds great. So less than a third of the class, but it's a sample, are retaining a high level of knowledge of the course material. Fantastic. And then a few months later, how's it going now? Well, we did a sample of 50 students and they're still retaining 98% of the material. Now you're only looking at a smaller portion. But if you don't look at the methodology behind the numbers and see that, well, the initial snapshot was based on 100 out of 350, and now the second snapshot is only based on 50 out of 350. If you take a smaller sample size, and could that professor be selectively choosing her best students to make herself look good? That's politics. It's not data, it's not science. And that's what we're seeing, I think, with monkeypox. It's not data, it's not science. It's focusing in the testing in a very reduced, at a very reduced level, to ensure that the case numbers, because that's what everyone pays attention to, is the case numbers went from 4,062 for the week ending August 20th. So they confirmed 4,062 cases August 20th of this past year for the 7 days leading up to that date. And now it's down to 967. So that creates the impression that, oh, wow, we were at 4,062. So the case numbers have dropped. Now we're reporting basically 25% of the case numbers that we were reporting last month. Yeah, but we're also doing 25% of the testing that was done in the month previous. Do I have any other notes? I had one other last thought, and it's off topic, not related to monkeypox, but it's talking about wastewater surveillance, an article from a couple days ago in Ottawa. As what they're doing is they're testing wastewater, and they're finding that the level of wastewater, level of COVID in Ottawa wastewater has increased significantly. And likewise, the positivity rate for COVID testing has gone up. Ottawa sees rise in COVID test positivity rate, wastewater, and outbreaks. And it's saying that there are more than 3 times more COVID in Ottawa compared to the same period in 2021. And this was posted to CBC News on September 20th, so 2 days ago, at 4:07 p.m. So things are even more. If there's seasonal components to COVID, and we've seen that, it goes in waves, up and down. So if there's seasonal components, when you're comparing last year at this time to this year, at least according to CBC's reporting, their COVID has increased more than 3 times in Ottawa compared to the same period last year. And I didn't link that article, but if you search it, Google it, Ottawa sees rise in COVID test positivity rate, wastewater outbreaks. And I've spoken about this in previous videos. I think it relates to monkeypox. I think it relates to COVID, influenzas, any pathogens that happen to be going around that have a seasonal component. And that's during the fact that during the cold winter weather, that rates of transmission increase for any number of viruses. And I think there's a false sense of security in the world right now, in Canada right now, because things have been good because it's the summer. It's like saying, why are you worried about snow? We haven't had any snow all summer. You know, it doesn't snow in the summer, it snows in the winter. Well, why are you worried about influenza, COVID, monkeypox, and all this stuff? We've had a really good summer. The numbers are really low. Yeah, viruses tend to, they refer to flu season sometimes as infectious season. And just because I have someone watching, I'll toss out the reasons why infectious diseases are believed to transmit. We know they transmit more during the colder winter months. And the reasons why are speculated to be that, number one, in Northern Hemisphere countries like Canada, people are out in the sun less, and we're getting less vitamin D, and that weakens our immune system. The cold weather has our blood vessels contracting, which reduces the delivery of disease-fighting white blood cells. Your nasal passages, respiratory tract dry out. That fluid, that mucus in our systems acts as a defensive barrier, and when it dries out, it allows pathogens, viruses to get into us more than they would previously. And another reason being that when viruses are airborne aerosols, that the humidity conditions in the air tends to be dry in the wintertime. People scratch at their skin. They want moisturizer because the air is so dry. What that dry air does is it allows viral aerosols to linger in the air for hours, and some studies have even suggested days. So you walk into the grocery store, classroom, shopping mall, any hockey arena, whatever it is, sporting place, large congregate indoor setting, and if there are a lot of people around, you are likely swimming in viral aerosols. They're out there. And if you think a mask is going to protect you, good luck with that, even an N95, because the 3 points of entry are eyes, nose, mouth. And so even if you cover completely, even if you wear a fully sealed, tightly sealed mask with a quality respirator apparatus, your eyes are still exposed, and it's just common. People touch all manner of common surfaces, and you wipe your eyes there. People do it without even thinking about it. So it's my video, and we'll see where we are in the coming days. The reporting on monkeypox is pathetic compared to the COVID era. COVID era, the reporting was coming out of a fire hose. Now it's an eyedropper. I don't watch the nightly news, but every now and again, I'll, once every 3 months, I'll click on to YouTube and watch a nightly newscast just to see what's being reported, just to see what's being out there. And very much a skim through. Okay, so they're reporting on the Queen. Okay, so they're reporting on the economy. Okay, so they're reporting on the situation in China and Taiwan and Ukraine and Russia and whatever, and just get a feel. But I haven't done that now for at least 2 or 3 months, probably at least 2, and since I've done that. But the times I have done it, I haven't seen any reporting being done on monkeypox back in May, June, July. So, and I don't think it's any, now that they're only reporting 967 cases for the week ending September 17th. If they're going to report it, they're going to report that, oh, things are fantastic. We're doing a great, the Biden administration, the Trump, Trudeau government in Ottawa has done a fantastic job of, controlling the monkeypox situation. Sure, they have, because they're not monitoring it, so they can pretend. That's enough for now. Good night.